Okay, welcome back, everyone. Let's look at the brain. Brain is a very interesting organ. It's one of the largest organs in the body, weighing about 3 pounds. Now, what is the brain doing for us? It's involved in so many functions. It's involved in sensations. It's involved in your memory. It's involved in your emotions, your emotional state. Are you depressed? Are you happy? Are you driven? Are you motivated? Are you more lazy? Are you laid back? Are you a go-getter, right? Different types of are you prompt in making decisions? Are you decisive? Are you indecisive? Do you make good decisions? Do you make bad decisions? How's your behavior? All of this is dictated by the structure of the brain and different parts of the brain. Let's look at decision making first. Okay. Someone has young children. The little boy pushes the little girl down the stairs, and mommy or daddy or grandparents say, "Don't push your little brother or little sister down the stairs. You know, they can get hurt. It's bad. They could break an arm or a leg." Okay. Do you understand? Yes, mommy. Yes, daddy. I understand. And then the next day, the 4-year-old pushes the 2-year-old down the stairs again. What did I tell you yesterday? Didn't I tell you not to push your brother or sister down the stairs? Uh-huh. Then why did you do it? I don't know. Right? It's this, I don't know, because they really don't know. The problem is here. The problem is in the frontal lobe of the brain. The frontal lobe of the brain helps you make good decisions. It allows you to inhibit, like you want to do something, but you stop yourself from doing it, right? Road rage. When people have road rage, their frontal lobe of their brain isn't working because the frontal lobe allows you to inhibit, to not do something. When we talk about ADD or ADHD, this involves the frontal lobe. When people, I give you a perfect example. I had a patient years ago who came into my office. She was a past student from probably 15, 20 years ago. And she came in with the symptom of peeing 20 to 30 times a day. She would always pee 20, 30 times a day. And we ruled out any type of tumor in the bladder. We ruled out diabetes, all the obvious things, ultrasounds, CAT scans. Nothing showed any problem to the bladder, the kidneys at all. So led me to believe that it was neurological. So she comes to my office. She's lying on my table. She's face down. I lift up the back of her shirt, looking at her lower back to see if there's any type of deviation to her spinal column that maybe is creating an issue with the nerve endings. And I see some metal in her lower back, like metal posts. And remember, this is like 15 years ago. And I said, what is this? She goes, they're called dermal piercings. And I said, "Okay, what is a dermal piercing? I just don't know what it is." She goes, "Oh, it's like an earring, but there's no back to it." I go, "How do you get it out?" She goes, "Well, it's like a surgical procedure to remove it." So I said, "Listen, I'm not judging you on this by any means. I just want to understand what what were your thoughts like when you said, 'I think this is going to be a great idea. I want to do this.'" And here's where the diagnosis came in. She goes, "I make these dumb, rash decisions all the time. It's impulsive. I just make these impulsive decisions. I want this tattoo, I'm going to get it. I want this earring, I'm going to get it." She goes, "I make these horrible decisions when it comes to drugs, alcohol, and men my entire life." I said, "I got it. I figured it out. I figured out her issue. It was her frontal lobe. There was lack of proper input into her frontal lobe. So she was making these rash decisions. She couldn't inhibit. Think of a baby that it wears a diaper. Why are they wearing a diaper? Because their frontal lobe of their brain isn't fully developed. They're only a few days old, so they pee and poop all the time. What happens to a person's frontal lobe of the brain as they get older? The frontal lobe breaks down and they can't control the urination and bowel movements again. So they're back to depends, back to an adult diaper. So think of a baby's heart rate, how fast it's beating, how quick they're breathing. Again, controlled by the frontal lobe that's supposed to inhibit and slow those things down. So with this young lady, When I treated her to stimulate and to balance out her frontal lobe. And that first day alone, post treatment, she only peed 3 times. She was studying to be an occupational therapist. She kind of deviated into focusing on neurology. So, because of her own experience being treated by me and being helped, her anatomical focus for occupational therapy specializes in neurology. It was very, very cool. So, each part of the brain controls different functions. Frontal lobe inhibits. Frontal lobe is your ambition, your drive, your motivation. When this is not functioning too well, this is someone that may be living in their parents' house or their parents' basement forever and ever because they just can't get things moving and going properly. It's not their fault, it's just an issue with that frontal lobe. Structure determines function. So the main parts of the brain are the cerebrum, that's the big part, and the cerebrum has parts of the brain that mimic the bones, the cranial bones that you learned. You learned the frontal bone, you learned the parietal bone, you learned the temporal bone, you learned the occipital bone. Well, the cerebrum has the same parts, but they're called lobes. Frontal lobe, parietal lobe, temporal lobe, occipital lobe. So those are all parts of the cerebrum, not to be confused with cerebellum, which is back here. The cerebellum controls your balance and your coordination. Balance and coordination. So balance and coordination is the cerebellum. So when a police officer pulls someone over during New Year's or Christmas Day, and they say, "Can you please walk a straight line, heel to toe?" They're checking your balance. They're seeing if alcohol got into the cerebellum, in which case you can't balance. You have no coordination. You can't touch your finger to your nose with your eyes closed. That's a cerebellum problem. Okay. The diencephalon, which is made up of the thalamus and the hypothalamus. Your thalamus is where all of your sensory input comes into the thalamus. That's the relay station for all of your sensory input, except for the sense of smell. All of the sensory input, except for smell, goes into the thalamus. All the sensory input except for the sense of smell. Your hypothalamus, hypo means under, so under the thalamus is the hypothalamus. And the hypothalamus is here and it's connected to the pituitary. So the hypothalamus pituitary connection is very, very important neurologically and even part of the endocrine system, both of them. The hypothalamus is your major controller of the ANS. So now we think back, it looks familiar. What's the ANS? The autonomic neural system was the sympathetic and the parasympathetic neural system, the accelerator and the brake. Speeds everything up, slows everything down, except for digestion where it flip-flops, where the sympathetic slows down digestion, parasympathetic speeds up digestion. So the hypothalamus controls the autonomic neural system. It controls your hunger, your appetite, your thirst, your sex drive, controls anger, your body temperature. All of that is hypothalamus. Such an important, important part of the neural system. The brainstem is made up of 3 parts: the medulla, the pons, and the midbrain. And from inferior to superior, it's medulla, pons, and midbrain, from inferior to superior. From the side view, here's the frontal lobe, here's the parietal lobe, here's the occipital lobe, and here's your temporal lobe. Frontal lobe, this is mostly motor function, and parietal lobe is mostly sensory function. So if you want to move your arm, The frontal lobe, especially right here, we'll call this A, the precentral gyrus. This is what's going where all the initiation of your motor signals begin in order to move your arm. It's going to send a photocopy message to the cerebellum because the cerebellum is going to help you coordinate that movement. So when you touch your finger to your nose, the frontal lobe and the cerebellum are talking to each other. If the cerebellum breaks down, you get the shaky hand. You get the shaky finger that's touching your nose. That's when you get these type of tremors and shakes. The postcentral gyrus, we'll call that B, that's where all of your sensory input ends up. So motor input starts at the precentral gyrus, but sensory input as it comes up and into the brain, it's going to end up somewhere in the postcentral gyrus. Precentral gyrus is where the motor inputs start and go down the spinal cord. Postcentral gyrus is where all of the sensory input ends up. Okay. The separation between the precentral and the postcentral gyrus is the central sulcus. That's that line right here that separates the two. You can see the medulla and you can see the pons. You can't see the midbrain. You have to cut out a little bit of part of the brain to see the brain, the midbrain. Okay, remember the brain stem is the medulla, the pons, and the midbrain. Again, same structures on a real brain. So we got frontal lobe here, occipital lobe here, parietal lobe, and temporal lobe. Temporal lobe is for hearing and taste. Hearing and taste is temporal lobe. Occipital lobe, that's where your vision, your visual center is. Parietal lobe is your sensory. Like when someone looks at their left ankle and goes, wow, my left ankle is so much bigger than my right, and yet they're the same size. That's a sensory issue. Okay, they're perceiving themselves differently. A lot of body image disorders, BID, body image disorder, is a problem somewhere in that parietal lobe and in the postcentral gyrus as well. Precentral gyrus is motor, and postcentral gyrus is sensory. So they call the postcentral gyrus your sensory strip, and the precentral gyrus they call your motor strip. And what separates the two is the central sulcus. Cerebellum is balance and coordination. Medulla and pons. Medulla is super important because cranial nerves 8 through 12 originate there, and the biggie is 10. Remember, cranial nerve 10 is the vagus nerve, and that controls 90% of human function. That's why chiropractic is so very important. That's C1, that top vertebra, the atlas, protects that part of the medulla, which is where the vagus nerve comes in. Vagus nerve is also a big part of your immune system. The vagus nerve connects to the gut. You ever hear the brain-gut connection? So it's like, what is your mood after you eat that food? The bacteria in the gut work up the vagus nerve and can affect how you feel. An adjustment of that atlas can influence the heart, the lungs, the stomach, the kidney, the spleen, detoxification, the liver, because of that medulla and vagal nerve relationship. It's super important. You ever hear of sudden infant death syndrome? Sometimes as a result of traumatic birth, when a baby is coming out of the vaginal canal and doctor has to grab onto the baby's head, it rotates the head excessively, turns it forcefully so that the shoulders can spin so the baby's shoulders can fit through the vaginal canal. Well, that excessive rotation can subluxate and damage the C1 when there's excessive rotation or compression of the atlas vertebra against the medulla, which can impact the vagus nerve, what ends up being affected is the heart and the lungs. So the baby sleeping on their stomach with their head rotated and turned even more shuts down the function, and there's sudden infant death syndrome. The baby dies in the sleep. There was a Dr. Gottfried Gutmann that autopsied 1,500 babies in Germany and found a 100% correlation between sudden infant death syndrome and what he referred to as atlantoaxial instability. When he autopsied the babies, he found something called atlantoaxial instability. When you look at those words, it's atlas and axis. So it's the relationship between C1 and C2. So traumatic birth is a very, very serious thing. That's why newborns, if there's a traumatic birth, should always be evaluated by a good pediatric chiropractor to assess the upper cervical spine. Too many babies today are dealing with um, they're on antacids because they can't hold down their food due to the vagal nerve going to the sphincter of the stomach, and they can't hold down the food, so there's projectile vomiting as a result. So let's take a look here. This has shown up on Connect. Here's the spinal cord, the proximal part of the spinal cord. As we move up, you have the medulla right here. And as we move up again, there's the pons. If this was cut away, we'd be able to see the midbrain. So it's medulla, pons, and midbrain. Now, when we look at the brain, there's hills and valleys. The gyri are the hills, and the sulcus are the valleys. So I'm going to show you the sulcus is this. It's kind of shallow. When we look at fissures, fissures are deeper. They're much, much deeper valleys. They're deeper depressions. Okay. So right here, if we look at the green on the top left, separating the left and right cerebrum, the hemispheres, that's the longitudinal fissure. When we go across this way, or even on the bottom going this way, that's the central sulcus. The central sulcus is what separates the precentral gyrus from the postcentral gyrus. That's the central sulcus. Here's the central sulcus down at the bottom. So in front of it is the precentral gyrus, and behind it is the postcentral gyrus. Okay. Now, in terms of function between left and right side of the brain, the left is spoken and written language, it's numbers, and logic. So the left, I think the left with linear, it's very linear, it's very mathematical, it's very science, is logic, all else. Your right side is more artistic and music stuff. It's more music awareness. It's spatial and pattern perception. Like, does this shirt go with these pants? Can I wear these stripes with these polka dots, right? That picture goes better, really nice in that corner. That couch will go better there. That's all like spatial and pattern perception. That's all artsy stuff. But recognition of faces and the emotional content of facial expression is all right-sided. Generating an emotional content of language, that's right-sided. You know, there are some people that teach this way. When they teach, they are very monotone and talk this way. There's no affect to their voice. They're left-brained. They're more linear. But the person that can generate emotion, that's a right-brained individual. Okay, females have a larger connection between their left and right lobes, and that's called the corpus callosum. The group of axons that connect the left and right brain, that's called the corpus callosum, and women have a much thicker corpus callosum. When there's a stroke or lack of oxygen and blood and glucose going to the left side of the brain, it can create a condition called aphasia, which is the inability to speak. When they have damage to the left side of the brain, they'll have difficulty in speaking, but they get paralysis to the opposite side of the body, to the right side of the body. When we look at brain waves and we look at sleep studies, we have alpha waves, beta, theta, and delta. When you're in a relaxed state and you're resting, you're awake, but you're resting, and you're calm, cool, and collected, we want to see alpha. When you're listening to my lecture and there's some mental activity, there's beta. When you're studying for a test and trying to meet all your deadlines and there's some emotional stress, we got some theta. When you're sleeping, we want to see some delta waves. Good place to take a break. And then we'll get into the next section.